Alrighty guys, so we are moving on and we're going to talk about what are the outcomes of promoting healthy behaviors. So we just talked about the 4 health behaviors that put us at risk, right? Tobacco use, drinking too much alcohol, lack of physical activity, and poor nutrition. So what happens when we promote healthy behaviors and we change those risk behaviors with healthy ones? What happens to our young and old populations? What happens to us as a nation? What happens to healthcare? What do you guys think? So promoting health behaviors and effective management of chronic conditions will give us healthier schools, healthier children, healthier workers, healthier adults working for businesses and employers, meaning less sick days, more production, more productivity, a healthier population in general, which helps our healthcare system. It doesn't bog our healthcare system down. It causes a lower healthcare cost and gives us a healthier population and healthier people. So how do we get there? So a lot of people, I'm going to go ahead and move to the next slide, confuse health promotion with health education. So we're going to talk about the differences in health education and health promotion, because these two things are what helps drive these programs and what helps give us that healthier population that we're striving for. But let's talk about health education first. So this is any planned combination of learning experiences designed to predispose, enable, and reinforce voluntary behaviors conducive to health in individuals, groups, and communities. So the key point here is that it's educational only. And most of the time this is actually done more on that individual level. So health educators, they may work in programming, they deliver information, right? So let's think about in a school, they're doing tobacco prevention, right? Those health educators are going to come in, teach probably middle school and high school students before they start smoking the risks of tobacco use, right? This is health education. This is educational only. And this will make a little bit more sense when we see the flip side of that as to what health promotion is. So think about health education. It's voluntary, and a lot of times it's only educational. And again, it's more on the individual level. So health promotion, on the other hand, is any planned combination of educational, political, regulatory, or organizational supports for actions and conditions of living conducive to the health of individuals, groups, and communities. So this is environmental in addition to educational. So this is one step above, right? So health education is kind of under the umbrella of health promotion. We can't have health education without health promotion. And health promotion is going to have all of these different aspects. So I want you to think about, it has that educational piece. So it's teaching people about the information and giving them skills and abilities to change their behaviors. But it is also introducing policies. So think about wearing your seatbelt, texting and driving, which is now a law. Think about no smoking policies on different campuses, like on our campus at the U of M. And then regulatory and organizational supports. You can think about introducing crosswalks into the community. This is going to be a behavior that gets changed because of those supports that are put into the community. And so really looking at how all of these different aspects change behaviors. So take some time now, review what I just said, digest it for a minute, and think about the biggest differences between health education and health promotion. Write them down as you're going through and as you're taking notes with this PowerPoint. So what did you come up with? What are the differences between health education and health promotion? So the biggest differences that I want to point out to you, for health education, the primary purpose is to influence antecedents, that knowledge, attitudes, and beliefs of behavior, so that healthy behaviors develop in a voluntary fashion. These individuals are ready for change. They're ready to voluntarily make changes to their behaviors. It uses primarily educational instructional techniques, and it's done mostly at that individual level. On the flip side, for health promotion, it does not endorse voluntary change in behavior, but uses measures to compel an individual to change their behaviors. Think about new laws or new policies. One thing is like wearing a mask. You can't go out in public if you don't wear a mask now, right? It is mandated that you wear a mask if you enter any public area. That is a policy. So that is a health promotion behavior change due to this health promotion programming. It entails methods beyond mere education, including community organization, networking, policy development, etc. And it's done mostly at the group or the community level. All right, so moving on. So those were those topics of health promotion, health education. And those are so important to have a good grasp on, especially those that are getting a degree in health sciences, because you'll be asked often, well, aren't you just a health educator? What do you do? And it's important to know this. And it's important to know it when you're developing health promotion programming as well. So if you'll think back to our last video, we talked about chronic diseases, and we're thinking about programming, right? We're thinking about that health promotion programming and these chronic diseases. And let's think about how we are going to prevent these diseases. So there are 3 levels of disease prevention. The first one is preventing or primary prevention. This is preventing the development of chronic disease by promoting healthy behaviors. So this is before anything occurs. So let's think about dental hygiene before individuals get cavities and have to have root canals and things like that. So often these are done in elementary schools, right? Or at those younger ages, because we can develop or we can start promoting those health behaviors at a young age to prevent poor dental hygiene, right? Detecting. This is our second level of disease prevention or secondary prevention. This is detecting chronic diseases in early stages to slow the progression. So what can you guys think of that may be a type of secondary prevention? What about screenings, cancer screenings, things like that? Screenings and testing is going to be detecting or secondary prevention. Mitigating. This is tertiary prevention. This mitigates complications of those chronic diseases to optimize quality of life and to reduce the demand on the healthcare system. A huge one of these is diabetes education and promotion and management, right? Like I mentioned previously, diabetes can wreak havoc and really take a toll on our bodies, and it's a huge healthcare cost to the United States of poor management of diabetes. So it's super important for us to teach diabetics how to manage their diabetes by healthy eating, medication management, and this reduces the risk or the use of our healthcare system. All right, so here again we have those levels of prevention listed. You can see there are some examples for each of these, so take some time to read over these. So example interventions for our primary prevention. Remember, this is preventing it completely from the very beginning. So fluoride treatments and dental hygiene, immunizations, we are completely preventing things like tetanus or measles, mumps, and rubella, things like that have been eradicated. Safe practices, exercise programming, things to prevent these bad behaviors from developing. Secondary prevention. Remember, this is screening and testing to find out the presence of disease and illness. So these would be self-testicular exams or self-breast exams, different laboratory tests, different screening tools like mammograms, and then tertiary prevention. Remember, this is going to be once that chronic disease has already occurred, but we're trying to manage it. So these are rehabilitation programs, diabetes management, cardiac rehab programs. All of those fall into that tertiary prevention. This kind of just reiterates what I said, but primary prevention, remember, this is before a disease or injury is present and it prevents it from occurring. More examples: wearing sunscreen to prevent skin cancer, wearing a seatbelt to prevent injury in a car accident, eating right and exercising to prevent obesity, hand washing right now, COVID, right? Hand washing and wearing our masks. All of those examples for primary prevention. Secondary prevention, activities that take place once the disease has already occurred. So we are trying to treat, reverse, or stop the illness. Again, cancer screenings, things like that, treating diseases with medicine. And then tertiary or rehabilitation activities that help with the quality of life. So physical therapy, occupational therapy, chemotherapy after cancer has already progressed. All right, so here's a fun little activity. I want you to name that prevention. So promoting birth control use. What level of prevention do you believe that would be? Write it down as you're taking your notes, okay? Promoting birth control use. Administering chemotherapy. Running a flu vaccination clinic. Giving physical therapy after an accident. Providing free HIV testing. And conducting cervical cancer screenings. Take a minute to jot down your ideas on which level of prevention those are, and we'll go over them next. All right, so for that first one, promoting birth control use, that is primary. They are preventing unwanted pregnancies, so that would be primary before the event actually occurs. Administering chemotherapy, remember this is tertiary, so that disease has already occurred and we are trying to manage it. Running a flu vaccination clinic, we are preventing the flu, so primary. Physical therapy after an accident, the accident already occurred, so tertiary prevention is listed there. Providing free HIV screening, this is obviously telling us if that person is positive or negative for HIV. This is secondary, that's screening or testing. And then conducting cervical cancer screening, again, secondary. Okay, so let's talk about some key assumptions of health promotion. These are things that people believe about health promotion. That health status can be changed. Appropriate prevention strategies can be developed. Behaviors can be changed, and those changes can impact health. The person must be motivated and ready to change. Many things contribute to the health and influence behavior changes. Initiating and maintaining a behavior change is difficult. An individual's responsibility should not be viewed as victim blaming. So these are the key assumptions to health promotion. These are the things that are true about health promotion and changing behaviors and our health risk behaviors that are listed. So it is difficult. People cannot change unless they're ready. There are prevention strategies that can be put in place, and we can have an impact, right? We can have an impact if the timing is right, we have good programming, we create great policies. All of these things can be true, and these key assumptions of health promotion are correct.